Hello everyone, and this is Ariana, aka the Melanin Nurse. And today we're gonna go a little bit different today. We're gonna be speaking in a different language. So I want to teach all my nurses out there how to speak a little phrases in Spanish, or even not even nurses, doctors, anybody who's watching, a little few phrases in Spanish you should know in the medical field. As we know, when you go into a patient's room, there's a few things that go down. Number one, you introduce yourself. Hi, my name is Ariana. I'll be your nurse today. Then secondly, you would say, oh, well, what's your name? What's your date of birth? Because we always have to identify the patient. After you identify them, you might want to take some vital signs, assess their pain, see if they need anything else, and walk out the door. Sounds pretty easy, right? But what if your patient doesn't speak English? Then you're stuck with the language barrier, and that patient's stuck in pain, like, oh my goodness, I'm in pain, and I don't even know what to do. It's very, very stressful for them. So this is what I wanted to do, basically, to raise awareness about patients who don't always speak English and ways to help them. If you go through this video and practice these phrases, it should help you when it comes through. First, when you speak Spanish and you have a native tongue, they often do speak kind of fast. So, if you do not understand what they're saying, maybe if you know a little bit Spanish yourself, you could always tell them to speak slower. And to speak slower, you would say, habla más despacio, por favor. Habla más despacio, por favor. Which means just please speak a little slower. So I just wanted to get that out the way, because I know a lot of people think when you speak Spanish, they're just like, they're going all this and that and that and that, and you just don't know how. I do it myself, even me. I've been speaking Spanish since 3rd grade, so I definitely need to say it myself. The first thing you want to learn how to say is, hi, my name is Ariana. So how we're going to say that is, hola, me llamo, and you would say your name. So, hola, me llamo, and your name. So, hola, me llamo Ariana. That's how you would say it in a complete sentence. Then you want to identify your patient. So you would say, well, what is your name? If you want to say, what is your name in Spanish, you would say, ¿Cuál es su nombre? ¿Cuál es su nombre? Basically, what is your name? I know there's other ways you could say it, but that's just the easiest way I feel like it is to teach. So after you say, what is your name? Of course, you have to ask when their date of birth is. So, when were you born? And you would say, ¿Cuándo nació? ¿Cuándo nació? Which is, when were you born? So after you ask when you were born, you also want to, well, let's backtrack. You also want to tell them that you're the nurse. So if you want to say you're the nurse, you would say, soy la enfermera. I'm the nurse. Soy la enfermera. So when you walk in the room, you would say, hola, me llamo Adriana. Soy la enfermera hoy. I'm the nurse today, which hoy means today. Then you would say, ¿Cuál es su nombre? And they would say their name. And you always say, ¿Cuándo nació? After you ask that, maybe they're having some pain. Maybe they're crouching over. Maybe they're rubbing something. That definitely would indicate that they're having some pain. So you could tell them to point to their pain. To ask if you want to point to your name, you would say, señale donde le duele. Point to where it hurts. Señale donde le duele. So, point where it hurts, basically. Another thing that you might want to say is, I need to check your vital signs, of course. And it's a little different. I'm going to check your vital signs is, voy a chequear los signos vitales. I'm going to check your vital signs. And they'll be like, okay. Anything that would make it easier for the patient, because of course they're gonna be like, what is going on? I do not know. They're speaking different languages. They barely know mine. But after they hear you say those 10 phrases, I know the patient will feel better. They'll feel more comfortable, because I've definitely been there. I actually volunteer at a clinic for uninsured patients, and there a lot of Spanish-speaking patients come there all the time. And even when I wasn't as excel as I was now, even when I was saying my little phrases like these, they would be ecstatic. They would be happy that anybody even tried or can even go face to face with them instead of shoving a phone. Like, yo, here's a translator phone. Those are terrible, especially with the different dialects they have. The dialect that they actually use for that is from Spain. A lot of people don't even know that there's different nouns that they use and subjects that they use that most people wouldn't understand. Even verbs are different in different dialects. So it's kind of hard, and it'll take way longer than they need to, and they'll never get the medicine that they need. So that's why I thought this video was important. So let me go over them all over again just to be sure. So first you say, hola, me llamo Adriana. Soy la enfermera hoy. ¿Cuál es su nombre? ¿Cuándo nació? Señale donde le duele. Voy a chequear los signos vitales. Now that you've got your cool phrases that you can say in Spanish, it will make any patient interaction a little bit easier. I hope you enjoyed this video, and please like and subscribe. Bye.